Hello again, YouTube. It is me. My double vision is being a bit of a pain in the backside today, so I have got my sleeping mask with me. 17 seconds in and I'm yawning. I've got my sleeping mask with me. If my double vision gets really bad, I'm going to use it to cover one of my eyes. I have some friends who suffer with double vision for one reason or another, and they have recommended various things to me to help me with my double vision. It's not there all the time. It comes and it goes, just like everything else, coming and going. Anyway, I received a letter today from my neurologist. Well, it's not actually my letter. My neurologist sent this letter to my GP. It's not a new letter. The letter is actually dated 17th of October. Because that's the day when I went to see, not the last time I saw my neurologist, but the time before that I saw my neurologist. And this letter frightened me because of what it mentions. Not a lot of people have my married name at the moment, so I don't get very many letters to my married name. And when it says private and confidential, I know that it's important and probably from the hospital. So, this letter I'm going to read to you. It says, "Dear Doctor," I'm not going to say my doctor's name. "Diagnosis, clinically isolated syndrome, bracket, multiple sclerosis. Today," as in the 17th of October, "Nina came to the neurology clinic, accompanied by her family members." That was my mum and my husband. "And I explained about the results and the diagnosis of multiple sclerosis. I have not had a diagnosis of multiple sclerosis. They like mentioning it quite frequently. I think this is the 6th or 7th time this has been mentioned to me. But no one to date has actually said, yes, you have got it." So that was one of the things that annoyed me. "I noticed that Nina is extremely anxious and has multiple symptoms from what she reads about MS on the internet. That's because no one kept me informed about what was going on. I was discharged from the hospital on the 11th of September, and I was just told someone will be in touch with you. I was ringing my surgery every week, and I was just told to wait. I've been told that a lot over the last 2 months. Just wait, just wait, just wait. She gets symptoms that might be related to somatization disorder." Now, I didn't know what somatization was, but apparently it's basically, the only way I can describe it is Googling your symptoms, because that's what I did, and I suddenly found myself having those symptoms. So, she gets symptoms, yeah, that might be related, yeah. I hate how doctors can't give you a definite answer about anything, I've noticed. "She has tried citalopram, but she thinks that it gave her a lot of side effects, therefore I recommended for her to stop it." No, he didn't. No, he didn't at all. He said, give it some time. If you find the benefits are not as beneficial as the side effects are debilitating or whatever, then stop it. He didn't actually recommend that I stopped it straight away. And then it goes on to say, "At the moment, I strongly recommend sending the patient for a psychology consultation locally. and I gave her the MS Therapy Centre telephone number and website address where she can visit and be involved in the local branch of Multiple Sclerosis Society. She will be reviewed in the neurology clinic in 12 months. So that is that letter. So the situation hasn't changed, but that letter is from an appointment that happened nearly a month ago. Nick read the letter, and he doesn't like how the letter is worded, but my neurologist is not British, he's from Poland, and when you speak to him, he gets his words muddled. We have first-hand experience of that. He's a bit hard to understand sometimes. Perfectly nice chap, but a bit hard to understand sometimes. So he didn't word that letter in the best way. I mean, he mentions the Marks and Spencer's disease twice in that letter. He mentions one as a possible diagnosis, but then he says diagnosis of that. So Nick thought that letter wasn't very reliable. Of course, I got worked up and I got a little upset, as I normally do. And that's what triggered a little bit of crying. Nick is currently at work. I'm going to my third anxiety course appointment today. What made me a little bit miffed is this letter, which took someone a month to send, suggests that I get referred for psychology straight away. I actually did that myself. I signed up for a lift psychology course through a very nice friend of mine called Izzy, who lives in the same town as me. So I've been going to this course, and I got referred from the course to my GP's office to start receiving counselling and some cognitive behavioural therapy, which is very beneficial for anxiety and depression. It's strongly recommended, and it is very beneficial. Originally the appointment was going to be on my birthday, 28th of November, but I begged them to move it back, which they said they did. The appointment I went to Thursday of last week at 2:30. I was keen to talk to someone professionally, but when I went in to sign in for the appointment, they had no record of that appointment at all. They only had record of an appointment on the 28th of November. So I was most unhappy about that. I begged them for a sooner appointment, which they have done, and it is this Thursday. I am really looking forward to it. I think I really, really need it. But I hate how everything at the minute is just waiting. I suspect a lot of people get this. Just waiting. Two of my work colleagues came over today. Two very wonderful people they are very important to me. And I was telling them what's been going on, what's been said, what's been done, how I felt. And they agreed that the way that this is being done just involves a lot of waiting, not getting a lot of support. Well, no real support has been offered to me, although I now am going to start speaking to my local MS therapy department. The reason why I didn't do that first of all is because I thought it odd that I was being referred to an MS therapy centre when they really don't want to tell me if I have it. But I think it would be good to speak to people who have it. And I've been told Some people that go to it don't have it, but they go to it for support. So I will be calling them and seeing if I can go to speak to someone or do something with someone. Just any kind of improvement, really. It is odd how all of the support that I have had has not been by any medical professionals or counselling professionals. I have had to do all the chasing. I've had to do the calls, I've had to do the emails, I've had to do everything. It's so frustrating. But my bosses at work understand the situation completely, and I want to go back to work. My sickness certificate finishes on the 11th of December, and I'm going to tell my doctor that I want to go back to work. I'm not going to let them sign me off again. Whether it be on a part-time basis, moving back to full-time, or straight back to full-time, the doctor will decide that. But I'm going to speak to the rehabilitation centre, because he mentioned that some changes would have to be made to my workstation. I think he was thinking about a bigger monitor and a different keyboard to help me with my typing. I'm not happy that the changes have to be made, but I know they are necessary. The stubborn woman that I am just wanted to go straight back to work full time. Everything springs back to normal. Eyesight gets back to normal. But I don't know if it's going to. I heard one person took them 7 months to get their sight back to normal. When I ask about it, they say that it can take average of 3 months to get the sight back to normal, but it can take longer. Today is day 2 months and 4 days since the attack happened. So the majority of my sight is back. It's not perfect, but the majority of it is back. I can read. I mean, looking at the screen right now, I can see pretty much all of it. I have to make the writing bigger, but I can see it. My right eye is still considerably weaker than my left eye, but I think it's been that way for a long time. So, I have got, as I've said, the eye appointment on the 25th of November, and I'm going to demand, I'm not going to beg anymore, I'm getting fed up of begging, right? I have spent the last 2 months begging for something, begging for an appointment, begging for an answer, begging for an MRI. I'm fed up of begging. Why should we have to keep begging something that we are putting money into? It's not something that we're sapping off of, something that we are paying into. In America, if you need an operation or someone to look at you, you have to pay. They provide a free clinic, but normally you have to pay. In the UK, you got private care, which you have to pay for, or you've got NHS care, which you don't have to pay for, but the money that goes toward the NHS comes out of our taxes. And I am still in employment. I'm not going to quit my job. So I still get taxed every month. I know that that money doesn't just go on the NHS, but some of it does. And I have had jobs since I was 16. I'm now nearly 29. And this is the first time that something that could change my life has happened to me. So, money from my wages, from everybody in the UK's wages, is going into the NHS. Doesn't that deserve some... I think that the NHS is so happy to fob you off sometimes. I'm sure they have procedures to follow. They have tests to run. I've had my fair experience of those. I hate how my hearing is today. My right ear is not completely blocked, but it's certainly being interesting today. I just hate how this is going on. Even the two people that visited me today, they agreed that the fact that the NHS are just expecting me to live with this and come back to them in October 2014 is really quite unacceptable, and I agree. I definitely agree. I know I strongly suspect an MRI is an expensive process, but I've heard from so many people that a quick diagnosis and quick treatment is a benefit. And as I said to them, when I have my next MRI, if it comes back and there are no new lesions, then the drinks are on me. I have 3 bottles of champagne in my fridge, which I will quite happily crack open and give to people. But if there are new lesions on my brain that are explaining why my left leg is affected, my left side is affected, my hearing is slightly gone, and my eyesight is not completely back yet, and the trembling and every other symptom that I've had, I'll rattle off a list in a minute so you can hear just how this is affecting me, then I want to know now. I want to know now so I can start the treatment. I already am starting to make these lifestyle changes. The lifestyle changes with the diet. I may not be able to cycle anymore. I may not even be able to learn to drive. I'll be very unhappy if that is the case. But I'm not going to let this bloody thing stop me. As I said to them, I refuse to let this thing win. Every single Marks and Spencer's disease sufferer in the world refuses to let this win. They've all been put out by having this. I get told new people get diagnosed every week, and I've seen some people do. I came across one person who got diagnosed shortly before I got on the forums, and she was as scared as I was. I'm still scared, but I'm also angry. I'm angry that my brain has decided to go, you know what, I'm fed up of being the good guy, I'm going to be the bad guy now. I hate that. I didn't want it to. I thought we were on a good relationship. But I refuse to let this thing win. And I said, and I might be quoting this, I'm going to make it my life's work to make this disease hard for itself, to deliberately make life for this disease miserable. And I even turned to one of them and I said, me and Nick are very confident that with the progression of medicine and treatment in the last 20 years, 20 years, this disease was discovered in 1868, I think. But only in the last 20 years has there really been some push, some real discoveries. But me and Nick are both pretty sure there's going to be a treatment in our lifetime that is capable of stopping this in its tracks for everyone. If it can't cure it completely, then fine, but they can stop it. Stem cell therapy, for most people, stops it. There needs to be some funding, some awareness and some research put into that so they can start rolling it out to everyone. It felt very odd but slightly therapeutic to discuss the Marks and Spencer's disease so openly today. I heard stories about people whose lives have been affected by things. Quite shocking stories. But I told them about my diet choices. I told them about my exercise choices. If I can't cycle anymore, then I've got to do something else instead, because the 7 miles a day, 5 days a week that I used to cycle was really helping. It was exhausting, but it was really helping. So the swimming should help with that. I'm so angry. So very angry about this. I'm angry that it's happening to me, but I am angry because it is happening in general. There are some wonderful people who are being affected by this, and they don't deserve it. I know there are other diseases that are affecting people, and they don't deserve it either. But it's not out of their way to cure this thing. They are understanding so much about autoimmune disease now, so much more than they used to. They know how MS works. They know that it's the immune system deciding to start destroying the myelin on your nerves that then attack the nerves. They know how it starts. They've even started figuring out what triggers it. Environmental factors, genetic markers, which don't apply to me because I have got no one in my family at all that's ever suffered with it. I am the first one if it does affect me. So whether this becomes it or not, I'm going to make it my life's work to contribute whatever I can. Volunteer for trials, answer questionnaires, give feedback, sit interviews if I need to, talk about it. I have learned so much in the last 2 months about this bloody thing. This pissing annoying thing that needs to be gone. And I'm pretty hopeful when I say if they can cure this, then they've got a basis to cure the rest of the autoimmune diseases. So, someday soon, someone is going to click in their head, or they're going to test something, find a very positive result, and then this man or this woman or these people are going to tell the world about it. And as I've said before, the world will be in so much joy about it. So many people will be able to say, I used to have MS. Used to. There are people now that can say, I used to have cancer. I used to have leukemia, although that is a cancer. I used to have this. People will then be able to say, I used to have MS, I used to have lupus, I used to have sarcoidosis. So much potential. It needs to be done. People need to make their money, there's a way of making money. People need to be cured, there's a way of being cured. It needs to be done. So now, because I've decided to post a relatively, this isn't negative, but no, it's negative because it's grumpy. I want to finish this video by saying thank you to Joe and Denise for visiting me today. I miss them all so much, and I am going to beg my doctor to let me go back to work on the 11th of December because it'll be beneficial not just for my team but also for me to get back into a normal swing of things, or as normal as it can be. That's what I need to do. I am not going to be off sick over Christmas, I refuse. If I have to go back part-time to start with, then so be it. So that's what needs to be done. but I want to get back to normal. I miss my full-time job, I miss the people, I miss the place, I even miss the customers. So it's time to start doing this work, time to start doing this. It needs to be done, it needs to be gone. Right, I'm going to end this video now. Thank you for listening. I now have to post something positive, which I think I know what I'm going to talk about. I will do that in a minute. Thank you.